I'm Danielle Holly Walker, Dean of Howard University School of Law, and I am hosting this segment of the live stream, the session twos for today. We are so honored to start off the day with this fantastic panel that's on economic justice and COVID-19. We are now streaming live on Facebook. You can find us on the Howard University School of Law page on Facebook as we're streaming live. Before we get started, I'm going to turn this over to Dr. Jones to moderate the panel, but I cannot get started without saying a special congratulations to Professor Thomas Mitchell, who is on this panel. Professor Mitchell won the MacArthur Fellowship last week, the Genius Award, with 19 other individuals. We are so proud of him as a Howard University School of Law graduate who's been doing groundbreaking work in the area of race and property law for many, many years. And to see his work so rightly recognized in this way has been a true joy over the last week as we've been celebrating his work. So congratulations to Professor Thomas Mitchell.
Thank you, appreciate it.
Dr. Jones, over to you.
Good morning, everyone, to the panelists in the audience. I am very, very excited about this session because, believe it or not, my undergrad is in economics, and I had the pleasure of having Julian Malvo as my instructor. Dr. Julian Malvo, who told us that there is an economic thrust to every issue that we have in the world. And we actually had to write articles about everything in the newspaper and talk about the economic impact. So now to see such a diverse panel, and we will cover environmental and health disparities, educational opportunity and access, employment and labor challenges, entrepreneurial survival, and everything tied to the impact of COVID-19 in the Black community. And without further ado, I'm going to introduce the panelists. We have Keeshea Turner-Roberts from Howard University. She is an adjunct clinical law professor and supervising attorney at Howard University Fair Housing Clinic. Professor Turner-Roberts attended the Catholic University of America, Columbus School of Law, graduating in 2002 with a Juris Doctor and a certificate in public policy. Lisa Grillo, as a teacher, leader, and scholar with over 25 years of experience in public education, she currently serves as assistant professor in the Department of Educational Leadership and Policy Studies in the Howard University School of Education. Her research is currently focused on the experiences of Black and Latino women who lead in educational settings. Prior to this role, Lisa successfully led district and school level initiatives to improve student outcomes for diverse student populations in large urban and suburban school districts. We also have Thomas W. Mitchell, an alum of the Howard University School of Law. He is a professor of School of Law and the co-director of the program in Real Estate and Community Development Law at Texas A&M University. Mitchell's articles have appeared in journals such as Northwestern University Law Review, Alabama Law Review, Wisconsin Law Review, Florida State University Law Review, and in American Bar Association and USDA publications, among others. He has also served as an editor and contributor to the first volume of the New Legal Realism, translating new law and society for today's legal practice in 2016. Andre Smith, Economic Justice Law Review, is a recovering tax and administrative law professor of 14 years, currently establishing the Economic Justice Law Review, a repository for scholarship dealing with race, economics, and the law. He is author of 3 books on the subject: Black Tax, The Relationship Between Tax Law and Racial Economic Justice, which was published in 2015, Taxes, Death, and Trouble, How Starve the Beast Tax Policy Created the Black Lives Matter Movement. I better say that again. Taxes, Death, and Trouble, How Starve the Beast Tax Policy Created the Black Lives Matter Movement. That was published in 2018. And the Afro-Latican jurisprudence, Smitty Baton's Appeal to the Colored Law Students of the World, which was published this year. Bonita Co., Johns Hopkins Community Physicians, is an alumna of Howard University College of Medicine, currently practices outpatient internal medicine at Johns Hopkins Community Physicians in Brandywine, Maryland. She formerly served as the faculty medical director at MedStar Medical Group in Waldorf, Maryland, and as well as associate clinical professor at the George Washington School of Medicine and Health Sciences. Last but not least, we have Matthew Watley, the Black Idea Coalition and Kingdom Fellowship AME Church. That is where he's from. He is an innovative and faithful pastor, nationally known speaker, author, professor, businessman, leadership consultant, and a kingdom builder. As the founder and senior pastor of Kingdom Fellowship AME Church in Silver Spring, Maryland, which is moving into a new campus on Calverton, Maryland, he provides leadership and spiritual guidance to over 5,000 members. Reverend Watley has served as an adjunct professor at Georgetown University and is the chair of the Black Inclusion, Diversity, and Equity in Action Coalition. The Black Inclusion, Diversity, and Equity in Action Coalition, which empowers organizations and institutions to achieve parity in employment, investments, and contracting. Without further ado, we would like to turn this over to Bonita Co., who will tell us about her research and her interests. We will start with her, and then I will start calling you after that. She's going to put a context to everything because she is the medical physician on this panel. Thank you. Bonita Co.
She needs to unmute.
Yeah, I'm honored to be on this distinguished panel of law people. And I thought I would just give a general context to what we're dealing with, since we're talking about social justice and economic justice with respect to COVID-19. If it wasn't for COVID-19, this virus, we wouldn't even be having this discussion. Just so briefly, not to assume that everybody listening knows, COVID-19 is a virus. It is a novel virus, meaning this is the first time the planet has seen this particular kind of coronavirus. And so that poses us, that puts us in a situation where none of us on the planet before this virus infected humans have seen this virus before. So that's why this is such a difficult problem. And so this virus has to go around the planet many times until we build up our immunity. But unfortunately, while that's happening, people are getting sick and people are dying from this virus. So that's the issue. Unfortunately, in a perfect world, this shouldn't be a problem, but because we have health disparities, people have different ways they access healthcare, because people cannot stay home, so this virus cannot be transmitted from person to person. That poses a problem. If you are in a low-wage job or your education isn't what it should be, because we have disparities in how we work, how we're educated, that means that we cannot follow the rules as far as staying home as much as we can. The context of all this is that this planet has seen many pandemics, epidemics before. We've seen many problems with viruses. A pandemic like this happened in this country 102 years ago. I do have patients in their 90s who do remember the flu epidemic in this country back in 1918. So we've done this before. It's just that many of us are not alive to remember that. And 102 years ago, we had the same problem: social distancing, wearing masks. So we have done this before, but unfortunately, what has happened with this simple virus is that a lot of it has been politicized, and unfortunately, this virus is also taking advantage of our social constructs that really are not in place to combat this virus. So this virus goes from human to human. It infects us in our mouths, our nose, our eyes. You can infect yourself from your hands. So that's why hand washing is very important. It's also very important when you're out in public to have on a mask. So if you are infected and you don't know it, which you may not be, you don't give it to other people. But it's not working how it's supposed to work. And so my comments about that is, in a perfect country, we would have leadership from the top down who would be able to orchestrate a plan for us to prevent this virus from doing what it does, which is invade our immune system, take advantage of our immune system, and go from person to person. But that requires that people are able to stay home. But if you don't have enough money, if you are in an area where you don't have enough healthy food, I don't call them food deserts, I call them healthy food deserts, because you can have a lot of food in your neighborhood, but that doesn't mean it's healthy. You have to have access to transportation. If you need to be tested, you have to pick a doctor, have a doctor. In this country, our healthcare system is not such that everybody has the same access to a physician for guidance. And then specifically with this particular virus, where you live, what city you live in, what county you live in, what state you live in is greatly affecting your access to being tested for the virus. It would be great if everybody, like other countries have done, everybody gets tested, whether you have symptoms or not. You don't have to be rationing tests like a lot of places are doing. So you can find out who has the virus, whether they have symptoms or not, so they can quarantine themselves and stay away from others until they're not infectious anymore. Because as long as this virus cannot go from an infected person to someone who is not infected, that's a way to, as we have been hearing on the television, flattening the curve. And so we don't have an infrastructure where all that's in place in an organized, systematic fashion. And then on top of that, contact tracing is very important, because if someone has been contacted by someone who has been infected, in the best environment, we would be able to notify those people, let them know to stay isolated until they're presumptively not infectious. And these are all the kind of things that need to be done until we get a vaccine. And I think talking about the vaccine is probably outside the purview of this discussion, but that's a whole nother discussion about developing a vaccine so we can have immunity. The other problem is, as far as having access to your doctor, also the other disparity we have, a lot of patients don't have equal access to broadband, which is an economic issue as well. So this virus has, I'll use the word, unmasked a lot of our deficiencies in our society with respect to disparities in healthcare, transportation, education, the ability to work in a safe place in the middle of a pandemic, the ability to make businesses stay viable while people are trying to stay at home, not getting in contact with the virus. And so I will hope that was a good enough context for this conversation.
Thank you, Dr. Koh. You definitely provided a number of segues to the other panelists. So we would like to now hear from Keeshea Turner-Roberts from Howard University Law School.
Good morning, everyone. Thank you again for participating, for allowing me to participate on this panel. I am eager to hear the solutions and perspectives of what the issues are from each of the panelists. As Dean Jones has said, I am a clinical law professor and a supervising attorney at Howard's Fair Housing Clinic, and I'm coming at this issue as a practitioner / academic. I'm going to talk a little bit about what my clinic does and what issues that I see that are popping up. Fair Housing Clinic provides law students with an excellent opportunity not only to earn academic credit, but also to learn how to be a lawyer and how to be a practicing lawyer. With regards to building skill sets, how do I interview my client? How do I analyze facts? How do I make a cogent oral argument? Those are the skill sets that my students are developing during the clinical situation. The Fair Housing Clinic, we handle housing-related cases such as housing conditions court. That means, say, if you have a client or a tenant whose ceiling has fallen in because of the severe rains that we've been having. That's something that we can try to address in court to have the landlords to make those repairs. Housing discrimination cases, such as if a landlord denies a tenant access or denies his or her application to apply for an apartment, and the basis of the denial is because of the person has a housing voucher, which basically a voucher is a government subsidy that pays the rent on behalf of the client. In the District of Columbia, it is illegal for landlords to deny applications when that income, that was the source of how the rent is being paid for the tenant. And so that's what we call source of income discrimination. That is really prevalent in DC, even though we have laws that prohibit discrimination on those bases. But those are the type of cases that we have, in addition to what I call eviction defense cases. And these are basically landlord-tenant cases when landlords are suing tenants for eviction on a variety of different reasons. The majority of the reasons that people get evicted in DC is, quite frankly, non-payment of rent. They can't afford to pay the rent, or they somehow are not paying the rent timely. The second reason is 7% of other filings or for other reasons. It could be fiction, like you violated a term of your lease, such as if your lease said you can have a dog and you have a dog, that's a violation of your lease. And so those are the types of cases that we do take. In addition to handling cases, we also do a lot of outreach in community education, where I think it's critical for us to do community education and what I call know your rights presentations. And we range the gamut of, can I get evicted during COVID? The answer is no, but people don't know that, right? What are my rights with regards to discrimination? What are my rights if I'm applying for a residence or application, submitting an application for an apartment? What things are the landlord or prospective landlords are allowed to do and what they're not allowed to do under the law? Okay, so some of the key issues that myself and my co-teacher, Valerie Snyder, what we see is there's going to be an escalation, a dramatic increase in the number of evictions after the COVID emergency is over with. In DC, we expect the DC moratorium to end around early March-ish, and we expect to have a increased number of landlords filing for evictions. And most of these filings are going to be for non-payment of rent because, quite frankly, people can't afford rent. People lost jobs. They don't necessarily have the other support mechanisms to help them to make the rental payments. And so there's going to be an increase of people making those filings. And then the second thing that we're seeing is that because of this moratorium, the suspension of the moratorium and the increased number of evictions, we're going to see a lot of our clients who are really struggling not only financially, economic-wise, but also mentally and physically struggling, right? There are a lot of barriers to clients or to tenants seeking to enforce their rights. And unfortunately, the coronavirus added another layer to that barrier. Normal barriers such as, where am I going to find someone to babysit my children while I go to court, right? Court in DC can be an all-day affair, right? And if you leave court, if you leave court without your case being resolved that day, you risk losing your housing, right? But also, if you don't pick your children up on time from school, your children can be removed from you, right? And so that's that back and forth about stressing whether or not I should go to court or whether or not I should pick up my children is that dynamic. Also, the lack of representation. DC is very generous in providing monies for more attorneys, legal attorneys to represent tenants in landlord-tenant matters, but it's still not enough, right? Basically, 90% of landlords have attorneys, and many tenants do not in these cases. So although this is good steps, there still is going to be a dearth of lack of number of attorneys to represent clients. Also, in addition to as I said before, in addition to now we have COVID, we have other barriers that were existing before, but now are adding to that layer. A lot of clients, quite frankly, are just not mentally or physically able to go ahead and to enforce their rights as they should. I mean, because they have other things that are a priority, and so we're seeing a lot of my clients are reluctant to go to court, reluctant to file, reluctant to disturb the relationship, if you want to call it, the relationship between themselves and the landlord, because there's a fear of the unknown. We don't know what's going to happen after the public emergency will end. We don't really know what's going to happen. And so a lot of people are reluctant. And I'm going to stop right there. So thank you.
Thank you. We would like to now listen to Dr. Lisa Grillo from the School of Education.
Thank you. Thank you. And I'd first like to thank Dean Holly Walker and my colleagues in the School of Law first for inviting me to be a part of this esteemed panel. I always enjoy the connections that we make between the schools of law and education. I think in order to understand the economic impact of COVID-19, particularly on Black and Brown students in public education, I think it's first important to look at how critical education is as it relates to economic factors. For example, data from the Bureau of Labor Statistics shows that the more education one receives in the United States, the higher their income. Specifically in 2017, the median weekly income for individuals with a high school diploma and no college was $712. For individuals with a master's degree, the income was twice that at $1,400 approximately. And for those with professional degrees, the weekly income was just a bit over $1,800. Conversely, when we look at unemployment rates for individuals with less than a high school diploma, the rate is at 6.5%. Individuals with a master's degree, it's at 2.2%, and those with a professional degree, it's 1.5%. So there is evidence that education has value. When we look at educational attainment by race, the US Census reported in 2018 that among Black Americans, 7% have graduate degrees, and 33% have no more than a high school diploma or its equivalency. So we also know that one pathway to increased wealth for Black Americans is increased educational attainment. But educational attainment is difficult to achieve when Black children are consistently exposed to educational systems that both undereducate them and miseducate them. The COVID-19 crisis has not caused these inequities that our children experience in K-12 schools, but the crisis has magnified and illuminated the inequities. We can add COVID-19 to the long list of symptoms of the racism that is deeply embedded in our educational systems and which denies a high quality education to Black and brown children. COVID-19 has revealed that at least a quarter of Black and brown students do not have reliable access to computers, as Dr. Ko spoke of, mobile devices or broadband, the internet, in order to engage in virtual learning. So for example, the Pew Research reports that 25% of Black teens and 17% of Hispanic teens say they often or sometimes cannot do homework assignments due to the lack of reliable access to a computer or internet connectivity, compared with 13% of white teens. Similarly, 6 in 10 parents with lower incomes say their children face at least one digital obstacle to completing schoolwork. What really is concerning and quite frankly disheartening about the crisis is that it was predictable and it could have been mitigated. We've been talking about the digital divide for over 20 years with little action or resolve. In fact, the United Nations declared access to the internet a human right. Social and economic inclusion in our society is dependent upon access to the internet. And Black and brown students experience digital exclusion, and this will potentially lead to a loss of learning, disengagement from their school communities, and access to the resources that schools bring. So I think it's imperative that we finally confront the racism that exists in public schools with regard to the practices and the policies and programs to which we expose students. We cannot simply look to solve issues like the digital divide without first addressing the lack of commitment that we've had historically to educating Black and brown students. And so I'll end there, and I'm happy to talk more about solutions in our Q&A.
Thank you, Dr. Grillo. We will now hear from Dr. Thomas W. Mitchell.
Okay, so let me just start again. So first of all, I want to thank Dean Holly Walker. Thank you for the shout out. I do appreciate it. I was kind of stunned, humble, but very grateful to receive the MacArthur Fellowship. The area that I work on is in property law. Specifically, some of my work focuses on the experience of African Americans who have become property owners or who became property owners at different stages in history. And then what happened to their property, focusing significantly on some of the legal mechanisms and other mechanisms that have contributed to that substantial loss of that property. But before I kind of get to that aspect in terms of its economic impact, if one kind of pans out more broadly, we know that African Americans went from having the status of being property themselves prior to the end of the Civil War to becoming property owners. But that group of African Americans that became property owners was a relatively privileged group within the African American community. So in terms of the economic impact, we can't lose sight of the fact that the overwhelming majority of African Americans never had the opportunity to become property owners themselves, whether we're talking about rural land and farmers or urban properties and single family homes, for example. And that's significantly the result of racialized laws and practices that denied that opportunity from the beginning. There's a second focus that also doesn't get sufficient attention, is that even African-American property owners, technically they're property owners, but they're not on the same footing. They're not, they don't have the same status. They're not able to leverage their ownership for economic benefit for a variety of reasons, including redlining, including particular laws that make it much harder for them to leverage their property ownership to generate wealth. And that contributes to a term I'll use, the racial wealth gap. But then in terms of, so I just want to situate my work to make it clear that it's addressing a subset of these property problems. But within my work, as I indicated, I look at some of the mechanisms that have led to this property loss. There are historically extra legal reasons, right? As opposed to what is the common narrative about lynching. And that common narrative is you were dealing with a black male who had some inappropriate interaction, according to the white community, with a white woman, whether whistling, looking at, whatever. In fact, a substantial number of African Americans who were lynched were upwardly mobile African Americans, including land and property owners whose very existence represented an existential threat to the governing philosophy of white supremacy. And that is often poorly understood. Setting aside these extra legal, in terms of murders and violence and intimidation that drove people out from their property, there are a set of laws, property laws, that have resulted in a substantial amount for African Americans in terms of property ownership. Kind of the five biggies are foreclosure, eminent domain, with a government, typically, not always, but sometimes the government will delegate its eminent domain powers to a private entity, but usually it's some type of governmental authority. Forcibly acquires somebody's title to their property, theoretically, for the payment of just compensation, which is supposed to be fair market value. Although, in fact, that legal right to fair market value compensation is often, especially for disadvantaged, disproportionately African American and other people of color, that right is not vindicated. In most instances, even though they have a constitutional right to that fair market value, they're typically not paid that for a variety of reasons. And then there's tax sales. And then there's the law of adverse possession. So I know everybody's not lawyers here, but just take my word for it. One of the areas I focus on is addresses the most prevalent form of what we call common real property ownership in the United States. And that's, the technical term is a tenancy in common. A subset of that tenancy in common property, until recent times, purely it was a colloquial expression, is called heirs property. And unfortunately for African Americans, a very high percentage of their family-owned properties is this heirs property or tenancy in common. And how does that arrive? So first of all, let's talk about heirs property. So that's not like heir, like A-I-R. That's heirs like H-E-I-R-S. What does that mean? This is a phenomenon that happens if you are a property owner, you don't make a will, and or an estate plan, and upon your death, your property is then transmitted or transferred to the next generation. If you have two or more legally defined heirs under what we call the laws of intestacy, and that's basically the laws that the state provides in lieu of people having an estate plan or a will. In every jurisdiction, including the District of Columbia and every state, the default ownership structure that will be that those who then receive the land or the property, and these are under the intestacy laws, these are the heirs, is this tenancy in common ownership. And obviously COVID-19, I think of it as an X-ray on our society that has revealed all kinds of things about our society that were pre-existing conditions. All kinds of things that some that we used to think of as great things, the American individualism spirit, and now we see that it's double-sided in people saying I have the individual right not to wear a mask, even if I'm going to harm other people, right? So we're seeing some of the things in our society that we're seeing as positives. We're seeing that it's a double-edged sword. But also, as we know, as we're talking on this panel today, there's a whole slew of racial economic gaps or racial healthcare gaps, incarceration gaps. One of the gaps that I've been proselytizing on the last couple of years that is not well known at all, but not surprising, is we have in the United States a racial will making and estate planning gap. 65% of white American families have a will or estate plan. Fewer than 25% of African American families have a will or estate plan. In every racial or ethnic group, not surprisingly, within the group, those with the most education make wills or estate plans at the highest rate, and those with the least. But here's a shocking statistic, at least that I've been trying, that shocked me when I stumbled upon this. So it turns out that, not surprisingly, African Americans in that highest educated group, those with at least a college education, sometimes a college education and a graduate or a college education and a professional degree, yes, they have the highest rate of will making among African Americans, but their will making rate is only 33%. For white Americans in that same educational demographic, their will making rate is in excess of 75%. So we have 2/3 of African Americans, just like everybody on this panel. So that probably means that 2/3 of our panel members don't have a will. I mean, panel of educated African Americans, which is, and I think that a lot of African Americans don't understand the consequences of that, right? So one of the consequences is if you die and you own property, your family will then inherit this property under this tenancy in common. And here's the thing about the tenancy in common is, among real estate lawyers, lawyers who practice in the areas of wills, trust, and estates, it is commonly known that this is the worst, most unstable form of common real property ownership in the United States. It's inherently unstable because there's this law called partition. Under the law of partition, any one of the common owners is entitled to go into court, file this action called a partition action, and then petition the court that among the remedies the court could order, the remedy they want is the court to order a forced sale of the entire property, irrespective of how small their ownership interest is. This is what we call undivided ownership. It's kind of like owning shares in a corporation. You have an interest in the property, like a 10%, whatever your interest is. So even if you have the overwhelming majority of those who own an interest in the property want to maintain that family property that oftentimes has been owned in a family for multiple generations, it just takes one person to upset the apple cart. And these sales, and this had been overlooked prior to my scholarship, the assumption was these sales were producing a fair market value price. And so theoretically, these families were at least not being harmed. At least they were getting money in exchange for their property. It turns out that most law professors and lawyers weren't paying attention to that in every state it mandates, well, what is the sales process that a court will use when they order these forced sales? And it turns out it's not a sale that's going to produce a market value price. It's a forced sale. Usually the procedure that's spelled out is either the foreclosure sale procedure or this more commonly, and this is borrowed from an area of law called debtor-creditor rights, something called a sale upon execution, which is a sales process that is well known among those who do creditor-debtor rights as never producing a market value price, as producing a price that's well below the market value, and often a fire sale price for, we're talking about pennies on the dollar. So as a result, unfortunately for African-American families, a significant percentage of those families who own property own it under a tenancy in common or heirs property because somebody in their past didn't make a will. And that means their property is incredibly susceptible to these forced sales. And if a forced sale happens, they're not going to only lose their property rights, they're going to be stripped of a substantial part of their real estate wealth. And the problem also for African Americans, and it's an understandable problem, is that when you compare the asset portfolios of African Americans to white Americans, they're very much not diversified. And oftentimes their real estate that they own constitutes a disproportionate amount of their assets. So if they then lose that asset and lose it in a fire sale, it's going to have a huge impact, right? So that's a contributing force to the overall racial wealth gap, where, you know, there's a variety of studies, but you know, many of those studies show that the average African American family has 10% of the wealth of the average white American family. All right, so then, you know, we can then later on talk about policy solutions, right? I got the MacArthur, you know, fellowship, you want to call it the Genius Grant, whatever you want to call it, because not only I identified this work in my scholarship, but then I proposed solutions. And those solutions, one of them, for example, is a model state statute that I served as the principal drafter for, that now has been enacted into law in 17 states and the US Virgin Islands, when it was predicted 20 years ago when I started that this area would be impossible to reform, largely based on, there had been attempts in a variety of southern states among those representing African American property owners to reform the law, and almost all of those met with failure. So when I started this work more than 20 years ago, people said, well, given this record of failure, what makes you think that you could have a different outcome? As a backup, you know, not only did people say that it was impossible, I was wasting my time. If I kept working at it, I, for example, might not get tenure as a professor. But their backup argument is you might have some minimal success, but certainly where it's the heart of the problem for African Americans in the southern states, you're going to run into a brick wall. It's not going to happen. Deep wisdom, and I can understand because there were these attempts in several of the southern states to reform it. Turns out that of the 17 states that we've gotten our law enacted into, 8 are in the South. And most recently in 2020, those states included Florida, Virginia, and this is one that I'll acknowledge shocked me a little bit. Mississippi, on July 1st, became the 17th state to enact it into law. So let me stop there because I want to make sure that everybody else gets to participate fully.
Yes, we'd like to hear. Thank you, Attorney Mitchell and Professor Mitchell. We would like to now hear from Andre Smith, Attorney Smith.
All right, thank you very much. And once again, Thomas, as a fellow graduate of the Howard University School of Law, definitely proud, very proud. Let me make sure I get my screen together. Okay, so I am a former tax law professor and administrative law professor. So my focus deals with the tax and the racial wealth gap that Thomas, Professor Mitchell mentioned. And I want to draw a connection between the wealth gap and the disadvantages and the disproportionate deaths and whatnot that we're experiencing with the COVID-19 virus. There have been some folks that have spoken about it. I want to say Catherine Powell has a very good article that was published in the New York Times. She's a Fordham law professor that talks about the connection between the wealth gap and COVID-19. But I want to take a tack that goes strictly through taxation, because that is an aspect of economic policy that we don't, of course, as a tax professor, I don't think we pay enough attention to because of its direct correlation to the racial wealth gap. I mean, taxation is in itself the transfer of wealth from one to another or others. Okay, so let me, I prepared some remarks, so I hope I don't bore you to tears with them. So today I want to talk about how neoconservative tax policy, federal, state, and local, has contributed to the current situation in which Black and brown people are overwhelmingly disadvantaged by the COVID virus. How tax policy is used to expand the racial wealth gap and thereby perfect and petrify the loose racial caste system Isabel Wilkerson writes about in her brand new best-selling book, Caste, The Origins of Our Discontents. How the racial wealth gap has a purpose which is to force Black and brown people, by and large, to accept whatever employment is available, regardless of the paltry wages, oppressive terms, or wretched conditions. And thus, Black and brown people find themselves on the front lines of every war against other nations, the war on drugs, war on crime, and now the war against COVID-19. Since we're talking about the loss of Black and brown lives, I also want to tie in how these same tax policies relate to the horrific deaths of George Floyd and Breonna Taylor and countless others. In 2018, I wrote a book, Taxes, Death, and Trouble, How Starve the Beast Tax Policy Created the Black Lives Matter Movement, explaining that, and this is hugely important when arguing with people over whether it is smart for the president to evade taxes known to be owing, that when the case of Citizens United tethers money to politics, the wealthy deploy their resources toward relentlessly cutting taxes year after year after year since the 1980s. And that when wealthy people refuse to pay, then those budgetary gaps get filled by authorizing police to extract informal taxes from Black people as criminal justice, fines, fees, forfeitures, interest, etc. We learned from Mike Brown and Ferguson, Missouri, that there are literally thousands of jurisdictions where over 10% and sometimes over 20 or 30 of the budget derives from law enforcement obligations. Moreover, it has been statistically proven that the greater the Black population, the more likely the government will engage in policing for profit. Obviously, increasing confrontations between the Sheriff of Nottingham, who was in fact that jurisdiction's tax collector, increasing confrontations between police and Black and brown people also increases the likelihood of police violence against Black and brown people. This is how Starve the Beast tax policy created the Black Lives Matter movement. So BLM and COVID-19 are related not just because they involve the disproportionate deaths of Black people without means, but also because they can be traced specifically to the racial wealth gap and the tactics that widen it purposely, intentionally, knowingly, although some surreptitiously. There is much consternation about neoliberalism and how free market fundamentalism or racial capitalism debilitates us as a people through systemic structures and implicit bias. However, tax policy reveals a neoconservative strategy specifically designed to impoverish the vulgar or the unlearned for the purposes of social control, to reward them strictly for valorous service against others, either foreign or domestic, real or imagined. Black and brown people, as we see ever more clearly, are those others placed on the outside of the national ethno-identity. Again, taxes provide the most vivid illustration of this distinction I'm drawing between neoliberalism and neoconservatism. For example, 21st century poll taxes that have either entirely disenfranchised or discouraged people from waiting in line for 10 hours, potentially exposing themselves to disease, are clearly neoconservative. They're not neoliberal. It is not the function of a free or idyllic market that is producing that. It is intentional conduct. Increasing the cost of voting in terms of dollars, time, energy, and health this year because of COVID-19 is not the product of inattention or benign neglect. There is design and implementation, including installment of judges on the circuit and Supreme Court who will produce opinions like Citizens United and the National Association of African American Media versus Comcast, which is otherwise known as the Byron Allen case, as well as Shelby versus Holder and Crawford versus Marion County, the combination of which eviscerated the Voting Rights Act and effectively nullified the 24th Amendment's prohibition against poll taxes. COVID-19 and BLM demonstrate that while neoliberals do not care a whit about us, neoconservatives are trying to kill us. They are, in fact, eugenicists. The solution is fairly obvious. Restore the progressive tax rate structure in federal, state, and local taxation. Don't just fight for higher taxes on the wealthy, but also resist the transfer of taxes onto Black and brown people in the form of sin taxes like Philadelphia's soda tax and its city's wage tax. But while the solution is simple, the fight, unfortunately, will be ugly. History shows this country's origination demonstrates clearly the wealthy will war over high taxes. They will spend $5 billion to save $10 billion. They will support and valorize those who arm themselves to defend the traditional American way of life, where wealth is concentrated at the top in a game of monopoly against other nations. While the Proud Boys and other terrorist groups may honestly believe they are upholding Western values, their funding is going to come from those who simply want to pay less taxes. And even though they don't say it, I truly believe the brothers, and white folks as well, who are still considering voting for this current administration are well-to-do folks singularly interested in lower taxes, largely unaware of the specifics how their allegiance with the 1% further debilitates and endangers Black children today and hereafter born. I do not equal being Black with voting for a particular party any more than I believe preventing the spread of COVID-19 by wearing a mask is the solution to the Black health and healthcare crisis. We must comprehensively address and combat the current social order regarding education, entertainment, economics, labor, law, politics, health, religion, and conflict resolution. But in respect of those monumental tasks, wearing a mask, social distancing, and voting are almost quite literally the least we can do.
Thank you, Attorney Smith. That was very powerful. We appreciate your commentary. We will now hear from Dr. Matthew Watley.
Hey, good afternoon, everyone, and good morning, everyone. Glad to be associated with this panel as a proud double alum from Howard. Excited about the work that we're talking about right now. And just for the record, when I was a grad student at the Divinity School, I beat 2 law school candidates to be grad trustee, just for the record. Anyhow, I'm excited to be the chair of the Black Idea Coalition. IDEA stands for Inclusion, Diversity, Equity, and Action. And it is a response to what we've seen throughout the summer in the wake of the killings of George Floyd, Breonna Taylor, and so many others. We recognize that economic justice is at the heart of all issues of justice, whether it's in health disparities, criminal justice, and any other means. All you have to do is follow the money, and you'll see how we got to where we are. The whole concept of the Black Idea is very simple. There has been an enormous response into this moment, especially by large banks and other corporations to pledge billions of dollars. As many of you all know, JP Morgan just pledged $30 billion. Before that, there was upwards of $3.5 billion pledged by Citi and a number of other corporations. The question is, where does that money find root and how does it actually get to its end user? The tragedy is that when we look across the landscape of our country, there is not a clearinghouse. There is not a place where this kind of capital finds its end users. So whether you look at contracting, investment, or in employment, the infrastructure is not there while the talent is there, contrary to some remarks made by the CEO of Wells Fargo several weeks ago. So what we're doing is organizing a number of capacity building organizations that will allow this since it's the largest pledge to date, JP Morgan. They've pledged $30 billion. And of that $30 billion, about $8 billion of that has been pledged to developing new housing. But we know that in order for that to happen, you actually have to have boots on the ground in local communities. And so who is equipped to do that? JP Morgan is not, its main business is not like a Wells Fargo where it's a consumer bank. And so how does it then make good on that pledge? One of our partners is Enterprise Community Partners that has 10 offices around the country and is a capacity organization that specializes in community development. So they're the group that if you live in Prince George's County, Maryland, and you're interested in developing your community and you form the CDC, they're the company that can come in, do a market survey, help you to find seed capital, help you to do the advocacy work to get the tax credits from the state, and work you through all the regulation, as well as to help you vet your potential development partners so that you all can actually build that housing. The truth of the matter is we have a great moment, but I think that we have to seize this moment with systems, infrastructure, and partners that can actually make good on it. Otherwise, we will look back at this time with great regret because the moment that we've all been praying for, since many of y'all look like you're about my age, since we were in undergrad or grad, was here, and we failed to take advantage of it. And so that's an example in the area of investment. Let's look at, for instance, employment. One of our partners is Canaries, which is a Black-owned consulting firm in DEI. They've created a great online application where you can actually go to their website, canaries.com, spelled with a K, plug in the potential company that you're interested in, and then get a specific grade as to how that company scores as it relates to DEI. And here's the key, and since I'm talking to a bunch of lawyers, you all will appreciate this. It is an intersectional study so that it's not a general grade of diversity. As you all know better than anybody else on the planet, the biggest winners of affirmative action were white women and not African Americans. And so this is not a general statistic. You can actually search by your specific demography, and it will give you an expectation of what the diversity in that company looks like. This is extremely important because, again, right now it's in vogue for everybody to get real pro-Black for this moment to keep up appearances in corporate America. But unless we have infrastructure that is objective, we're going to see a bunch of companies grading their own homework, giving themselves A's, and moving on to their next fire. And so we're very excited about that. One of our partners is the Joint Center for Political and Economic Studies. Many of y'all know them. They celebrate their 50th anniversary this year. They're our only Black think tank. And so because much of what's done in policy as well as in corporate America is data-driven, we need to be able to shore up our only think tank and actually have more to do the work of research and then allow that research to find its birth in policy so that we can actually affect systemic change. So we're excited about it. Let me just close, since I'm a preacher, let me close with the contracting area and talk about how while we often look at companies, we often don't look at them at a multi-pronged approach. So we'll talk about how many African Americans are working. And then, you know, if we're really sophisticated, we'll say, well, you know, is that C-suite? Is that on the board? Is that entry level? But I want to suggest that we really need to expand that ask and ask how much business to business money have you all committed to the Black space? And we were very specific about saying Black because, again, it is almost a euphemism to use diversity to mask another level of systemic racism. If you take a look again, we certainly want to celebrate JP Morgan's commitment, but if you look at the $30 billion, 50 million of that 30 billion is actually committed, 750 million of that 30 billion is committed to working with Black and Latinx suppliers. And so that's hugely important because, as we know, the small businesses of our country are the heart and soul of employment in our country. And so if you look at how you actually move the dial and create another engine of Black wealth, it is about providing new means of access to Black businesses. And of course, the other one for Black businesses is access to capital. You can't scale if you don't have the money. And so I'll stop there, but I'm very excited about this conversation. I'm excited about this work because I recognize that we have an opportunity, and my prayer, since I'm a preacher, is that we don't waste the window that God has opened up to us.
Thank you, Reverend Watley. I have a question. We have some common threads around here. Now, Attorney Turner Roberts, she works with tenants, but I was thinking a number of our landlords may have been in some of those red line districts. They lived there for a while, and then in upward mobility, some of them left the areas where they were redlined, and then so they became property owners because they held on to some of the properties that were in the red line areas. So what is the recourse for the landlords when during the pandemic, the COVID-19, and you have the local government saying that we cannot have evictions, but they're not wealthy landlords, so they need the revenue from the rent to pay for the mortgages to hold on to their property. So what are their recourses? And I turn the floor over to the attorneys to speak of that.
Thank you. I can't speak to a lot of that because the majority of the focus of what I do is just tenant-based. I guess what I will say is that they are programs for individuals who in risk of foreclosure. There are programs that they can seek with the government to apply in order to avoid that eventuality. What I will say is that that there are very few mom and pops. I think that they will survive this this time because there will always be someone who's willing to be rented from them. I think that it's kind of almost like a red herring just to say that the mom and pops are going to suffer. And when I mean mom and pops, I mean small, like super small landlords, like landlords who own maybe 1 or 2 properties, right? I think there's always going to be market for them, right? So I really think that they are going to, the harm to them is not going to be as severe, I don't think, as much as other media outlets are playing that up. So, but I'll like to hear a response from maybe Professor Mitchell on that issue or others.
I mean, I do think it is a legitimate issue. If you have a moratorium on rent and there are mom and pops, I think in terms of landlords, I mean, some of the data that I've seen is that it's not a trivially, what they call it, mom and pops or a small landlords, right? Whatever that means. You know, we're not talking about 5 or 10%. We're talking upwards of 40, 45, 50%. So if you have a moratorium on rent, oftentimes we see landlords bad, tenants good, but if you actually then parse, it is a problem. And I think that some of the people who have been proposing is that our overall response to COVID-19 at the national level has been lacking, right? And I think that's an understatement. We've obviously had the stalled talks on what would be the next round. It doesn't seem like that's going to happen anytime soon, unfortunately. There's going to be a lot of carnage because that's not happening. Some of the folks have been proposing that we had a much more robust response, including paying people who can't go to work and income. They would have an income stream, and that income stream, part of it would be able to pay their rent so that there wouldn't be losers. So I think there is an issue. To me, let me just kind of pan out a little bit broader. I mean, that's one example of an economic issue for that group of African Americans who are property owners. But I'm part of a study of this. You know, I'm very proud of my research collaborators on this study, where we're looking at what is the economic impact of the loss of agricultural land among African Americans in the last 100 years. So just quick data point, in 1910 or 1920, 1 out of 7 farmers in this country were African Americans who owned the land. Today, you have only 1 to 2% of farmers are African American. 98% of farmers in this country are white, which also has an implication in terms of our trade war with China, because unbeknownst to most of the public, the Trump administration has been pouring in record numbers of billions of dollars of subsidies.
Talk about it.
99% of that money that has been propping up farmers has gone to white farmers.
Yeah.
So that's one thing. In terms of the value of the land that was lost, my research team has, and there's awesome people on it. There's an awesome public intellectual economist, Derek Hamilton, now at the New School, Nate Rosenberg, Bryce Stuckey, and Dania Francis, who's at UMass Boston. So our conservative estimate, and we're going to be publishing a paper in the spring, is the loss of that agricultural land, $330 billion. And it's a conservative estimate because we're now working on a more robust that takes into account that, well, if these people had maintained their property, it's just not the fair market value of their property is. What do people do who are property owners? They leverage that property so their children can finance a college education. And there's an economic value to that. So we are thinking that by the time we finish the study, we're going to be adding several hundred billions of dollars as a fallout from that loss. And a lot of that loss was generated by USDA systemic discrimination that targeted Black farmers to force them out of the farming sector. The Great Recession, who disproportionately got hurt by the foreclosure crisis? Once again, Black and brown people. There was a direct impact to those who, and we call that reverse redlining. So these were property owners who were specifically targeted by banks and lending institutions for these high interest predatory loans. The direct impact to that group was a couple $100 billion. Sorry, I got my dog in my home office. But then there was a collateral damage to the African-American property owners who retained ownership, who were located in a high foreclosure area, and that was a few $100 billion. So I just wanted to try to draw a through line a little bit between impact currently maybe on African-American and Black and brown landlords, but also to the broader economic impact of this kind of land loss, whether we're talking agricultural land or we're talking single family homes and, in municipalities, suburbs, or rural areas.
If I can piggyback on what Professor Mitchell was saying, I was always interested. The great scholar Dorothy Brown at Emory has done work on not just the agricultural aspect of real estate and those disparities, but she has also written about what she may call our overinvestment in real estate. So as much as my heart and sympathies, I'm a West Philadelphia native, I'm a public school kid, so I definitely have great affection for those who serve as tenants. But however, Black folks that are seeking to be upward mobile, and especially even coming from those impoverished areas, have largely invested in a strategy called buy the block, where they invest in Black neighborhoods and become landlords and property owners as a way to uplift themselves and also their communities and prevent them from becoming blighted. Before I went to law school, I didn't go to law school until I was 27. But prior to that, I worked at household finance and I sold second mortgages. And one of the reasons I left was because I could not make home equity loans in Camden, New Jersey, with property the same value where we could make loans in Swedesboro, New Jersey. The difference being Camden, New Jersey is Black and Latino. And so they were prevented from getting loans. If this would today, right now, those loans that would carry them through, those loans that could help them pay the mortgage while we get through those crises, they're not available to our people as they are to others. And so since we don't want to penalize either side, I do think the policy solution is the stimulus packages that have helped the banks, that have helped the larger entrepreneurs, that they need to also help the consumers. Those stimulus checks did in fact go to help pay rent, to help pay those crucial bills and keep the tenant in the property and the property in the hands of those small investors. So this crisis, unfortunately, to the extent it is currently, that program or stimulus packages have been held up, I think is a very huge problem. Absolutely. And also, and let's draw this again closer to COVID-19. If we have evictions, where are these people going but to family and friends and create overpopulated houses and homes where you can't escape the COVID virus if one of the people in that house has it?
Yeah, can I just make one last data point on this? And this is, like I said, I think of COVID as being an X-ray on our society, exposing these pre-existing racial disparities. So pre-COVID, in 2004, represented the high water mark in US history in terms of African-American home ownership, and it was about 50%. Pre-COVID, the home ownership rate among African-Americans, 40%. That is less, and here's the shocking point. That rate of home ownership, the 40%, is less than it was at the time that the Federal Fair Housing Act was enacted into law in 1968. So you would expect that the Fair Housing Act would produce all these benefits. It was going to increase home ownership rates, and we are now behind the curve. And that's just a kind of a shocking statistic to me, is 50 years after the Fair Housing Act, that we have lost ground.
And if I can jump in to add to that, the decline in Black small business ownership from the first to the second quarter of 2020 has declined by 40%. And so I think when you add all these numbers together, it suggests that we are in for a protracted recovery under the best case scenario if there's a change in administration. And if there is not, I don't have the capacity to imagine how we survive moving forward, given the kind of structural damage economically that's happened to us as a community.
Thank you. I would like for us now to speak of strategies, because we have viewers and they're engaged in these powerful conversations. Now, I've heard a lot of solutions and some of the information you've shared with us. Now, if you have left out some, that would be fine. But I would like for us to instruct those who are listening, what are the solutions that you are recommending so that we won't continue on this trajectory of what we're going through for the pandemic and after the pandemics? And who should they write to? What should they do? Let's consider who will win the election in November. What would be our recourse if that person stays in versus a new one comes in, Biden comes in? What should we do? How can we continue your movement? And we can start with anyone.
So I don't want to dominate. So I do have ideas. So I'm just going to put that out there in terms of the area I work in, but I'll defer to other folks who want to start, unless you want me to start.
I will throw out simply that when we talk about this particular election, and there are lots of people who will argue that there are very thin differences between the parties when it comes to race relations and the racial wealth gap and what have you. But as a tax professor, the difference is stark. The difference is wide. The difference is clear and obvious. And so when we talk about solutions, state, local, and federal, nobody likes taxes. I don't like to pay taxes. On the other hand, we have to understand the broader context that when we refuse to pay, I mean, as it's been said, taxes are the dues we pay for a civilized society. And we have a certain amount of people that just refuse to chip in, and we are now seeing right in front of our faces the results of their lack of contributions. So that to me is a mindset that we have to deal with, that of course, as individuals, we don't like paying taxes. As Black folks, we want to keep whatever it is that we have, and then we get that. And there's a certain sympathy towards withholding monies from a government that does not treat us very well. I totally get that, totally get that. However, the long-term debilitating effects on health, on education, and the fact that they will in fact fill those budgetary gaps through informal taxes means that we have to align ourselves with whoever can force or get the wealthier citizens among us to pay their fair share.
So let me jump in for a second. I'll try to be brief. Obviously this panel is not all lawyers, but we have a subset who are. So what another gap we have in the United States is African-American population is about 14.5% of the US population. The percentage of lawyers who are African-American, 5%. So already we got a gap there. One of the things that in the course of my law reform and policy work that has become very stark was that among African-American lawyers, they are very skewed to not being in the areas that implicate asset preservation, asset protection. In other words, there is a very small percentage of African-American lawyers are real estate attorneys. Who do wills, trust, and states. Or Andrea will love this, tax. And so if you think about the kind of legal skills you would need to build wealth, to protect wealth among African Americans, we're severely underrepresented. And this really hit home to me with my model state statute in the early years when I was working on getting it enacted into law at various stages, raising consciousness. So I'd get invited, for example, to the American Bar Association's annual meeting to do a panel. So these are all lawyers. The folks who would attend my session, overwhelmingly African American lawyers. I'd give my panel, and all of a sudden, all these lawyers would come up to me and say, hey, my family's got that problem with heirs property, whether it was in an urban or rural area or whatever. And my initial reaction was great. So what kind of advice are you giving to the family in terms of having them upgrade their form of ownership into a more stable structure, whether that's an LLC, an LP, something we call the tenancy and common agreement? And I started saying, so what are you doing to help your family? And there was this blank stare, like a deer in the headlight. And the response was, we have options. And I was like, what do you mean? But then I said, what area of law do you practice in? And overwhelmingly, it was criminal law. Now, we obviously know with George Floyd and Breonna Taylor, and we can go on and on. There is a critical need for African Americans to be criminal attorneys. But the point is that we are so underrepresented in the areas that we need. And I always tell people, a lot of folks, want to count on, well, reparations might happen. I say, even if reparations happen, then we're gonna have and if there's a transfer of money or property, then we're gonna have the asset protection problem. And there's historical examples in the Native American community and others where there was some asset transfer. It lasted less than a generation because there were predatory speculators who preyed on these folks because they didn't have sophisticated knowledge of the law or the ways to protect their assets. So even with reparations, we could be talking about a Pyrrhic victory if we don't have the infrastructure in place to protect that. The last, I'm talking too long, but the one other thing I will say that I've been trying to proselytize about is that the model state statute I drafted was for an organization called the Uniform Law Commission, the organization in the United States that's had the longest record drafting and promulgating model state statutes. Most people haven't heard about it. Most lawyers haven't heard about it. Most law professors haven't heard about it. Well, you're familiar with something called the Uniform Commercial Code, the UCC. All lawyers know that. And they say, well, where did that come from? Is that manna from heaven? Or no, the Uniform Law Commission promulgated it. And the problem is that in terms of progressive politics, is oftentimes when we're dealing with progressives, there's an over focus on federal responses, despite the fact that our economy disproportionately is at the state level. And so what the right wing has is they both got a federal strategy and a state strategy. At the state level, there's an organization that promulgates model state statutes called the American Legislative Exchange Council, ALEC. Right-wing organization. They have promulgated stuff like the Stand Your Ground law that led to the murder of Trayvon Martin. And so they're very active in that space of thinking about and generating ideas for conservative state statutes. There's been almost a complete ignoring of that space among progressives. So one of the things I've been trying to proselytize about is use my example of what I've accomplished in terms of this model state statute and the Uniform Law Commission and copy it, right? Irrespective of what area of the law you think needs to be reformed to benefit African Americans and other people of color, right? And don't put all the eggs in the basket of we're going to have federal reforms. All right, so let me stop there.
Yeah, I'm gonna have to bring some other people in. Dr. Grillo, do you have any suggestions or any strategies?
Yeah, I can say that from an educational perspective, there are some urgent needs right now with regard to the crisis. For example, there are a number of students who are just unaccounted for in public schools. And so there's an urgent need to find them to make sure that they are getting, they're being educated and they're participating in virtual learning for those districts that are virtual only. And also that they have access to some healthcare services or, food and all of the basic needs that they have that schools meet. So there are some urgent needs, but, I see this crisis also as an opportunity, if I may borrow Professor Mitchell's metaphor about the X-ray, and how this really is illuminating many of the issues that we have been denying in education for decades. And so perhaps this is an opportunity for us to finally say, we have to address the inequities that Black children face in public education. One of the solutions, long-term solutions I would offer is to take education, or the education of our children, out of the hands of so-called education reformers who really are financially motivated in terms of their intentions, and really creating a critical mass of Black community members and parents who are on boards of education, are in PTAs, who really are motivated by seeing Black children display the excellence that they innately possess. Also create a cadre of critically minded superintendents and school leaders and teachers who are unapologetically able to go into schools and be their authentically Black selves and advocate for students with regard to discipline policies and grading policies and access to AP courses and gifted education. We know that there are Black teachers and leaders in school districts who have every intention of doing this, but they are not given the freedom to do so. And so we need to create systems that allow them to work on behalf of children. And then finally, really looking within schools and within classrooms, I think it's important for us to understand that Black children are not blank slates. They come with a particular cultural orientation. And so one of the things that is really lost in our conversations around educational reform is curriculum. And so offering children an African-centered or authentically multicultural curriculum is really essential to their performance and to increasing outcomes for them, and the research completely supports that. So I do think that there's some urgent ways that we can address this, but again, it all comes back to what Black children face as a result of racism. And so we really have to address that very aggressively, but then also creatively by creating the schools that we really want to see for our children.
So what is the low-hanging fruit for you? If anyone who's listening to you right now, how can they get involved immediately? Is that to find those students, the children we have lost through the pandemic? What is the low-hanging fruit for you?
So I've seen, in terms of children who are lost, maybe reaching out to your neighbors, to your family members to see if children are enrolled in school. And quite frankly, if they have access to internet, some school districts are providing that free of charge, or some cities are providing that. So I would do that. I see that some Black parents are engaging in co-ops where those parents who are working, they're dropping their children off at others' houses. And so they have small learning groups. The reality is that all children are not doing very well with virtual learning, and they need an adult present and working with them directly. So this really is a sort of a community grassroots approach to saying, your neighbors, people on your children's football teams, in your communities, in your churches, are there children who are not getting what they need, so that we can make sure that they get what they need.
Thank you. Dr. Cole, would you like to chime in?
Well, while you guys are working on all of that, what I would have to agree with Reverend Watley, I don't see that in our current environment, we are going to get better unless there is a leadership change, because what we need, I don't think, is is going to happen with what we have now. That's the first thing I'll say. So for everyone who's listening, everyone knows what they have to do to make that happen. As a physician, it hasn't been all bad, because what I have found is that for Black people, this pandemic has made people stop, sit down, be still, stop running around, and think about what's going on in their lives and think about their health. And in fact, I think a lot of people are doing a lot better because they're not eating out as much. Now, I know that we have said, support your local business, order something healthy, out once a week. But a lot of people are doing better about thinking about what they're eating. If you don't have a doctor, pick a doctor. It's not that a lot of us don't have health insurance. It's just that we don't even go. Do you know what your blood pressure is? It should be less than 120/80. If you have high blood pressure, you have the medicine. Are you taking it? If you have underlying conditions, high blood pressure, high cholesterol, diabetes, is it controlled? And that is not just on the doctor. Are you monitoring at home? And the big thing that has really made us be able to get through this pandemic is telemedicine. We have been trying to get insurance companies to pay for this for at least 10 to 15 years. And now the insurance companies, including our federal insurance, Medicare and Medicaid, have been forced to pay for this. And it has really helped us stay connected with our patients. And if you have a cell phone with a camera, you can connect with your doctor. Don't assume that I can't, or your doctor can't do something for you over telemedicine. We have been waiting for so long to be able to do this on a large scale. There's so much we can do with telemedicine. And in my specialty, internal medicine, a lot of what I do is a cognitive specialty. It's what I am thinking about my interaction with my patient. So there's a lot that can be done. Home, what are you eating? What telemedicine, what I do with a lot of my patients, I have them turn that camera around and I take a tour of the refrigerator and the kitchen cabinet. And I am physically, like I'm standing there, get rid of that, get rid of that. Helping people read labels, really hands-on, face-to-face, educating people about what they eat. Yes, we have healthy food deserts, but you can do a lot by controlling if you have comorbidities or chronic conditions, by having them be controlled. And what is frustrating as a physician is that we have spent 6 to 7 months. So many of us have sacrificed. We've missed homecoming. We've missed birthday parties. We haven't traveled. And we still have this segment of the population who do not want to make the sacrifice that we're all making. And that's just going to prolong it for all of us. And that's what I mean by modeling leadership from the top. Because I've on TV, being a doctor, I do come home and I sometimes watch the news and people are saying what you guys are talking about. Well, I don't want to pay people to stay home. I do. I want my tax dollars. You are right, Andre Smith. I want my tax dollars to pay everyone to stay home, because if you're at home, you got to keep your circle close. Then the virus can't go from one person to another. That's what our leadership is for. That's what our tax dollars are for. So, in my institution, I'm not so much concerned about PPE, because the medical community, we have had to, we're flapping, and we figured this out because we didn't have time to wait on the federal government, the state government to give us leadership. We could not wait. We're making our own tests. We're making our own reagents for the test. Depending on what state you are in, the governors, the progressive governors went out and got us tests. So regardless of what's happening on the large scale policy level on the ground, we had to make it work for our patients, because if we didn't, it would be much, much worse. And, you know, as a doctor, of course, I'm going to say this, it's too much politics on TV. We need more attention to the science, because this virus does not care about party. It does not care about policy. You know, I've been on conferences like this, and people have said, well, I don't want to believe it because I can't see it. I don't know what else people want. Do you want a camera going through a hospital in a COVID unit, watching somebody die, suffocate alone? What else do we need before a lot of us change our behaviors? Now, in the context of this conversation, it's about disparities. It's about people who wish they could do what the doctors are saying, but they cannot, because they work for employers whose employees are dispensable. And if you get sick or worse, they'll just replace you with somebody else. So they have no motivation to make the workplace safe. I have so many patients asking me for letters to stay home. I write a letter for anybody who asks me, because if you can stay home, you should. Of course, wearing a mask when you're out in public, washing your hands, social distancing, all that. But there's things that we can do, not be in large groups gathering. I know you're tired. We're all exhausted from this, but the more we cannot transmit this virus from one person to the other, it would be great. But
Thank you, Dr.
One more thing, the most immediate thing that we can do, we have to change our leadership. And I agree with Andre Smith. It's a stark difference between the two. We cannot keep, what we're doing now is not sustainable.
Well, and I think you answered the question that was posted on the Q&A. I'm hoping that Teresa D was happy with the response, but everything that you mentioned covers the question, which was the discrete things that can be done to improve the health of individuals, to improve their outcomes. I think you covered that. So we are out of time now, but I would like to thank this esteemed panel. You brought a lot of things to our attention, things that we need to address, issues, your solutions, and so forth. We really appreciate the time that you have, I don't want to say expended, but shared with us at our Howard University Homecoming Virtual Conference. I wish we had time for closing remarks, but we really don't, because our session is officially over at 11:30. But I want to thank everyone for participating, and we appreciate you.
Thank you so much to this outstanding panel. It really was just incredibly topical, timely, and critical information for our community. And so I really appreciate all of you for joining us. We will be back at noon with our next panel, which is Black Lives Matter and Policy Recommendations. We will have Dr. Ivory Toldson with us, Dr. Christopher Emden, and Maurice Mitchell from the Working Families Party to talk about the policy implications of the Black Lives Matter movement. I hope everyone will join us there. And thank you so much to each and every one of our panelists this morning, and to Dr. Jones for moderating. Have a great afternoon.
Take care.
Thank you, everybody.
Thank you, Dean.
Thank you.